So you successfully finished your postgraduate degree, MSc Health Informatics, Digital Health, Public Health, Genomic Medicine, or whatever postgrad degree. You've been applying for jobs, and unfortunately, you've not been landing interviews, and you're asking yourself, "What am I doing wrong? What am I not getting right?" Right? So, from my experience, there's an area that could be your stumbling block, which is your supporting statement. Now, if your supporting statement is not solid enough, if it doesn't sell your market, then you're not going anywhere. That's why a lot of recruiters make a lot of emphasis on a very solid supporting statement. Hello, everyone. My name is Dr. Ron. If you're new here, I talk about everything healthcare. I also make videos for healthcare professionals who are looking to transition into health tech, maybe from clinical care and all of that. And today I'll be walking you through how to write a very solid supporting statement to back up your applications so that you can land your dream role, especially in the NHS for health tech roles. So, but before I go into that process, I'll just give a brief talk about supporting statement. Now, supporting statement is very critical, and it's the evidence a recruiting manager uses to decide if he or she is going to shortlist you for an interview or not. So basically, it's your chance to sell yourself. It's a chance to say, I fit in the person's specification. It's a chance to say, I have all the qualification, I have the requisite experience. Basically, it's just your chance to make a good impression, sell yourself, tell them what you're going to do and the value you're bringing to the organization. So that's why it's very important piece of evidence for recruiters. Now, there are some steps you need to take before you start writing your supporting statement. Number one, you need to prepare in terms of um you don't just stand up and start writing a supporting statement. You have to prepare what experiences do I have that relates to this role that I'm trying to apply for. You put them down on paper. What qualifications do I have that suit that? You put them on paper. So that's part of your preparation process. Then after preparation, you need to do a little bit of research into the organization you're applying to work for, right? Because you need to understand their values, you need to understand the job, you need to understand what they do, what are their services, mission, vision, and all of that, because that also helps you, craft your supporting statement, solidly to get in tune with the values or whatever they do. So that's very important. Prepare, research. Then the third step is to always keep in mind the star model of interviews, right? So you don't need to go into details when using the star approach in answering some of the questions. Star means the situation, the task, the action, and the results. So keep that in mind always when writing your SOP. And lastly, after these first three I've mentioned, you need to use real life examples for your SOPs. You don't just write because you're writing. You have to use relevant situations to back up your statement. So, for example, I work a lot with EMRs, electronic medical records, and all of that. And I see a job role that is an EMR related, maybe it's an implementation project or something. I'm not going to use my, examples from probably writing or doing YouTube videos and all of that. I'm going to use my experience working with EMR to support my application for probably an implementation manager or analyst and all of that. So you have to use relevant real life experiences. It mustn't also be from maybe job. It could be where you're volunteering or other aspects of your life, but that's usually what they want to see, real life experiences in your supporting statement. So these are the four key things you need to keep in mind while writing your supporting statement. So I'll just share my screen now and let's run through the process and what you need to do, especially as it pertains to the NHS. Really, this is like NHS focused SOP. So I'll just share my screen in a bit and let's go through.
Now, there are a lot of job sites where you could look for NHS jobs or jobs generally in the UK, because that's what we're talking about today. But I prefer using the NHS websites, which is this. So I sort of find the user interface more interesting. And yeah, I think that's why really. So, like I did in my last video, you need to understand the key terms you're using for your job search. So, in this case, I'm looking for digital project manager, digital health type of jobs, and all of that. So, I could just put this here digital project manager, click search. So you see there are about 95 jobs with this description. So basically just scroll down, look for whatever you want, or take your time to read each one to see if you match the person description. So I've already found one here, which is this one, the digital project officer at NHS Kent and Medway ICB, that's Integrated Care Board in Ashford. So this is like a summary of details about the role at a glance. So you can see when it's closing, the salary, when it was posted, the job type, and all of that. So taking this further, I click on this and it takes us here. Now we're looking at the job in details proper. I mean, if you're going to write a strong supporting statement for your job application, this is where your job starts, reading the job role in detail and understanding what it is that you're going to be doing. So here we look at digital project officer. This is the name of the trust, NHS Kent and Medway Integrated Care Board. Closing date 18 January. So this is like a job summary, and they just list out all what the person will be doing, the main duties of the jobs, about us, about the organization, then the job description, responsibilities. Um, then yeah, I noticed that some trusts actually do this. So they organize open sessions where people, come in to understand more about what the trust is doing or what the different job openings available are like. So if you see any of this, you can please apply to attend the open sessions. Then you come to the person specification where they talk about the experience, qualifications, and certificate of sponsorship. So anyone you see here, they are potentially likely to sponsor, but that's not our focus for today. So any supporting statement you're going to write has to neatly tie into the person specification and the qualification, right? So this is very, very key. And some jobs might have essential criteria, essential here. Then some also go a step further to talk about desirable criteria, right? So it all depends. But rule is you must tick all the boxes for the essential criteria. So I just quickly go here. I download this job description. When I download it, this is what I have here, NHS Kent and Midway. So I just quickly, means basically don't need all of this information now. So because some of them have been repeated. So quickly I just scroll down to the person specification, who they are looking for and what are the requirements. So this is where you should focus your attention on. So now like I mentioned before, you have to tick all the essential requirements box. If not, nobody's going to get you shortlisted for the interview. So for the person specification, now see the first one, you see qualification, educated to a degree level in relevant subject or equivalent level of working experience at a similar level in a specialist area. So you want to check, do you have a degree? So for example, now you could have an MSc in digital health, right? So that sort of qualifies you to be able to do this role. Or even if you don't have that degree, if you probably have years of experience doing that particular role. For example, I've worked with EMRs, different electronic medical record systems. So even though I don't have a certification, though I've completed my program now, um, I could boldly say, okay, I'm very good at this, and you sort of describe what you've done around that area. So that also sort of covers the equivalent level of experience working in a similar level in a specialist area. So let's just go back briefly to this. So let's look at the main duties of the jobs: to work alongside digital leads to ensure robust clinical assurance processes, to assist with tracking and reporting project groups, attend meetings, attend ability to manage and prioritize workload, professional. So this is more like a support role, sort of, because you're gonna be assisting the PMO. So let's go back to the person specification. So you saying you have an MSc in digital health, or being able to display years of experience doing a particular field. So you could look for a similar project, similar to what these guys are asking for. And if you have the equivalent experience, I mean, you go ahead to describe what you've done so far, and that sort of covers that part. Then in the experience part, they ask for further training or significant experience in project management, financial management, and supporting change management processes. Now, for the UK, they are particular about the Prince 2 certification, which is like project management. So they prefer the Prince 2, right? But again, if you've got significant experience managing projects, you're able to, understand the whole project life cycle from initiation to completion, then you should be able to talk about that and saying, okay, like the finance partner, I mean, if you're managing projects, you're also in charge of budgeting, right? So that's financial management. So how are you able to manage a project, maybe within allocated cost and all of that? Then supporting change management processes. For example, deploying digital care systems or EMRs or solutions in a healthcare facility needs a lot of change management. So how were you able to do that? Did you liaise with stakeholders, internal, external, key users, and all of that? So you should be able to give specific examples how you did that. I mean, it doesn't have to be in detail, but just capture that. Then experience and understanding of evaluating and measuring the performance of health services. So if you've done this, I need to see, now I'm talking from a recruiter point of view, I need to see what you've done or the experience you have in measuring performance of health services, maybe quality improvement and all of that. So you need to tell me that experience in communications and stakeholder management, right? So, I mean, for example, if you're a doctor or a nurse, I mean, you communicate every day, you're talking to patients, you're talking to colleagues, you're doing reports for your line manager or presenting to senior management and all of that. So that's like communicating both orally, written, and even through presentations and all of that. So you've got that covered. So you should be able to talk about that. Strategic thinking, you should get an example to talk about that. Clear attention to detail combined with the ability to extract key messages from complex analysis and all of that. So basically, the idea is, for every job description, you have to read it in and out, then look at the person's specification and what they're looking for. And you answer those questions one after the other, because they tend to look at your supporting statement and probably measure it side by side with what they're looking for. So you need to check all the boxes, line after line, line after line, line after line, until you're done with it. Then you now go ahead to sort of arrange the answers in paragraphs, add linking words, make the whole essay move smoothly, so that anybody reading it, it makes sense to the recruiter. So in some areas where you might not have maybe the requisite skills, for example, if they're asking for Prince 2 certification, you could say that you're working towards a formal certification in Prince 2. So that sort of covers you. But the main thing is to make sure you answer all the questions or requirements that are listed in the essential criteria list. So for the desirable, if you don't meet all of those ones, nobody will punish you. But if you do, probably an added advantage for you. So that's how the key thing about doing these SOPs. I mean, you need to check all these boxes. So I'll just quickly open a sample I wrote. Let me see if it's here. Yeah. So this is the role for a digital health advisor, and this is the supporting statement I wrote. So I mean, another thing is when you're doing applications like this or writing SOPs, you need to sit back and ask yourself questions. I mean, because most times when you sit down and ask yourself those hard questions, you find that you've actually done a lot over the course of your career. So it's just being able to, bring them out and put them on paper to say, I actually did this. So for example, here I talked about over the course of my career, which has spanned over 8 years, I've worked with different health startups in developing and scaling their products and these blah 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 blah. These roles involve the use of data and reporting systems. In my role as a clinician, I was responsible for supervising monthly collation of statistics to be submitted to state government, some of the data collected, including number of immunization, number of births, and that. So I was trying to talk about my experience with data collection because the job description was tied around managing data and all of that. So I needed to show that I mean, I've got some experience doing this. Then I prepared monthly reports, which I share with stakeholders via emails or in some cases using formal presentations. I played a key role in the development of COVID-19 triage tool, which helps support the national response to COVID-19. And in the process, improve my knowledge of product life cycles, stakeholder engagement, and agile development processes. So I mean, this was how I took it line by line, line by line, line by line. And again, something I forgot to mention, for every answer you're putting down, you need to always have the star approach at the back of your head or wherever. So, I mean, situation, the task, the action, and the results. What happened, what did you do, what was your role, and what was the outcome. You constantly have to put that at the back of your mind while you're writing your SOP. So, like here in terms of work experience, I mentioned some of my work experience was in the public sector where I work with government hospitals. In my role, I was involved in interfacing with stakeholders from different organizations like pharmaceutical companies that we serve. So I think here they were asking for experience of working in the public sector or in government-owned hospitals and what it was like. So I said, yes, I've done that in my Guinea and this was what I would do, engaging stakeholders. And one of my key responsibilities was to ensure that clients got services they paid for, ensure customer satisfaction, onboarded new staff, and prompt resolution of complaints. I also went ahead to talk about my experience managing projects in charity sector. Uh, then here they mentioned experience of doing presentations. So here I said all my work life has been about presentation to individuals, small groups, and large groups. During my time, I was involved in doing marketing presentations to board members, staff of companies, and onboarding presentations to crowds as large as 300 persons or more you know. Then aptitudes, abilities, this is where you now start seeing things like tell us how you work in a team, how do you escalate issues? I mean, do you have good work ethics and all of that, interpersonal skills, diplomatic skills? You need to be able to tell all of those. Then what are your values? Things like time management, your ability to prioritize effectively, working under pressure. I mean, okay, for example, I used an example here. Using my studies as an example, the essay deadlines are startup close. I've been able to meet up my assignment deadlines sometimes 3 days earlier, balancing it with holding a part-time job, volunteering, and spending time with my family. So this sort of tells whoever that is reading, okay, this guy is able to, prioritize and deliver on the job. So, I mean, this is what a lot of employers are looking out for. So, yes, this is how it basically looks like.
So my key message from this video is to make sure that you tick all the boxes in the essential criteria list, meaning you should answer all the questions in that essential criteria list. So either you have the qualification or you're working towards it or whatever. So all the questions listed on the essential list, you have to tick them, or else nobody is going to invite you for an interview. So interestingly, I mean, it's something one of the recruiters shared with me. And basically, I'm just talking from my own experience, really. It's not like I'm a recruiter or HR personnel and all of that. I'm just talking about what I've done, what worked for me, and how I got into interviews. One of these days I'll probably make another video to talk about, I mean, the number of applications I did and what the process was like, because you still also need to keep an open mind that sometimes you might write the best of SOPs, but you still don't land an interview. So you have to keep that in mind. So if this video has been helpful or useful, please give us a like, give us a subscribe if you've not subscribed, and also share the video. If you've had some experience or whatever personal experience you've encountered, maybe applying for jobs or SOPs and all of that, you could also share in the comment section with us, so that every other person can also learn about different challenges. I mean, all our experiences are very different when it comes to job applications. And again, I also want to say that, I mean, what I've said here is not just for health tech roles alone. It also applies to clinical roles and other. It mustn't be health IT roles really. So I think the same principles actually apply. You have to follow it the way they've asked you to. So that's how very strict, and it could be a bit tedious, but I mean, it's what it is really. So you just have to play by the rules, tick all the boxes, essential criteria, prepare very well, research the company properly, use the STAR model. That's the situation, the task, the action, and the result when answering those questions, and make sure you use real life experiences to buttress whatever points you're making in the supporting statement. So, for example, I mean, I probably should have said this before. For example, if you're applying for, let's say, a role that involves electronic health records implementation or analysis or system analyst or something, I mean, so if at some point in time in your life you've worked, with EMRs, or you've worked as a system analyst, so that job you've done in the past neatly ties into what you are applying for. So you should look for specific examples within that particular role. For maybe you could say, when we're deploying, there was resistance from the doctors. I had to interface with them, teach them why this solution was necessary, and this was what happened, and this was the outcome. So I mean, it's relevant to the job role you're looking for. So those are the kind of real life examples you want to use to buttress whatever application you're making. And also, if you want a couple of the SOPs that are written for, I mean, the successful jobs that I've done, or the ones that landed me interviews, yeah, you could just comment, drop a comment in the comment section, probably pop in your email, and I'll just forward a couple of them with you, so that you see how I approached each of the questions. I'll probably also, to make it more contextual, I'll also try to find the job description for those jobs and my response, that's my SOPs for those jobs. So it makes it easier for you to understand how I approached it, right? So that's it for me on today's episode about writing SOPs and all of that. So I wish you all the best in your job applications, and hopefully you land the job of your dreams. Until I come your way next episode, I still remain your host, Dr. Ron, and stay safe, stay good, and remain blessed. Bye for now.